Asami team. So when you see Dr. Ekmore, you have easy access to see Dr. Asami, you have easy access to see Dr. Falcon. We're going to promote that team component in our next round of sales.
You know, I don't know Dr. Keller, but I've known 2 or 3 people that have had prostate cancer, and coming from different directions for the laser surgery, Dr. Keller, they tell you that, one of the doctors told one of the patients was, look, if you're gonna have, if you've got prostate cancer, you need to have laser surgery done. You need to go with the guy that has got the most experience, and that's Dr. Keller. He's done more than anybody
When
in Texas.
My uncle was gonna have his, he did all this research on the internet and called doctors in Houston and El Paso and every place in between, and everybody said Dr. Keller. So he looks him up on the internet and he says, guess what? He's standing in front of your hospital. So, can you give me an appointment? That was a pretty big endorsement. That was a pretty big endorsement.
But how many people know that?
True.
Sometimes you don't know
He's
it.
seeing what, 30? He's seeing 30 patients in his clinic every day that he's here.
So that word's getting out.
Yeah.
Which a lot of times you don't, I mean, until you have a need for a urologist, you don't really pay a lot of attention to your urology. Once you have a need, then it becomes a focal point. Same with the heart doctor, cardiologist. You have heart problems. The only reason you're gonna be aware of heart doctors is if you have relatives. I mean, I know Dr. Nyack because he's taking care of family. But,
Don't you think it's a supply and demand thing, when you don't have demand until you have supply?
We've talked about that in this committee a lot, we've done.
We really never had any demand for a urologist here because we never had a supply of urologists. But now we do, now there's demand, that's why.
and I bet that'll be one area where once the study data comes up, you're gonna see a lot of movement towards San Antonio on urology stuff. Based on age and stuff in the county, but, and he's only here 1 day a week. There's a lot going on.
This information we looked at first is gonna help us with, what do we need to supply? Like, who's driving by this place going someplace else to get services we don't provide? And I think that'll help, us figure out.
Yeah,
what we need to
say
supply.
it'll help tell us, can we support bringing on urologists more than 1 day a week? How many days a week can we support bringing on urologists? That kind of data is going to be there to help us.
I think these are both good, a little tweaking possibly. Let's go back to the marketing and the selling. This is a great piece, but I think what it is to me, it's a point of sale brochure.
You bet.
You gotta take this out there and get in front of somebody and say, look at this, and look at this, and look at this, and here's what we're doing here, and you ought to read about that, it's good stuff. I mean, this is a point of sale brochure, and if it's used that way in the right places, that's gonna be fantastic. If it's not, it's gonna sit in the corner and gather dust. We've gotta get out and promote it and show people the good stuff that's in there and get them to read it. That's the sales part of it.
So then, who's the audience? Is it the physicians?
I think it's anybody that'll listen, quite honestly. I think it is the Lions Club and the PTA and whoever will listen. There ought to be a 15-minute presentation about Conley. You can do it right out of this brochure, and then anybody that'll listen to you, we ought to ask for an invitation. A new business opens in town, an old business. We need to see if we can get 10 to 15 minutes to tell you and I the day.
We did that, that's right. That was really good.
That was great.
That was really good.
And you know what? It worked so well, we stopped doing it. That's not a good idea. We need to do that.
That was a lot of
Our
fun.
marketing team needs to be out there talking to people and getting the word out. And I guarantee you that goes 10 times further than, 100 brochures like this. You gotta get out there, you gotta sell it a little bit. And then they'll say, you know what, he was talking about that, I'm gonna read about that. What did he say? Oh, yeah, okay. And that's gonna make this effective. That's gonna make it effective.
There are companies that you can hire that can provide a ton of information as far as what I think we're saying here. There's media planners, there's marketing companies, and they can strategize, they can look at your demographic from various ages, and they can pinpoint exactly how to spend your money for advertising, whether it's, print media, digital media, whatever it is, and they can, be very specific about how to do it, or what to do. So there are companies out there that, and some really nice ones here in San Antonio, but just my children happen, my daughter and my son-in-law and my good friends, Lionel and Kathy Sosa, I mean, this is what they do, and they're very good at it. So there's some people that I know that could probably provide guidance if it ever got to the point where you said, we want to develop, this marketing strategy, and they can get very specific for you.
I mean, is that what our marketing staff is here for?
Well, yeah, but I mean, they're.
Do they have that?
Major. The only thing I can say about that, really, it's a good point, but major corporations like Coca-Cola and stuff, they hire companies like Whataburger, and I mean, those are the clients that these people have worked with and are working with now. And so they're really nice, because have you seen the cool little logo with the theatrics, carnivores wanted? Isn't that cool?
That's great.
Well, Lionel and Kathy, developed that for Tom. And Tom's not here, but they're local. I mean, they used to live here in Floresville, and I'm sure they could provide some guidance if we ever wanted to invite them. They're really cool. I'm just saying they're very, very nice. And there's other companies. Andrade out of San Antonio, they're amazing. So they do some really cool stuff, and they're very affordable. Lionel and Kathy are a little more expensive, but it's just an idea. Because there's digital media, and that's a whole new world in itself.
Good points. So let me kind of hit just a few other quick items along those lines. Both obviously because of the EMS project, but also because the EMS project is a subset of the larger common story. I'm going to be on the circuit throughout the next couple of months. I'm actually committed to do the November lunch and learn. We typically have had physicians, but I'm going to do the November lunch and learn. I don't have a date on that yet, but I think that'll be really good timing for us. We can close out the annual report, talk about EMS. That'll be our November lunch and learn. Typically, we get about 60 or 70 people at those, so that's not too bad. And then, of course, given all that's underway, we'll be making the rounds to Chamber of Commerce's, both Floresville and Vernia. City councils will be both next week, and just kind of be out there telling the story. The EMS conversation obviously is one of the questions, but I think you guys know me well enough that I'll be able to work in the rest of the hospital story into some of those conversations. So that's part of my plan there. But the bottom line is, Larry, I mean, you're right. You and I did a great thing when we had that one client visit, and there's just no reason why we can't do. We in the marketing team can't do more of that.
Yeah. Quick question on the EMS. We've all seen some of the press lately. I don't think there's been much reaction from the things that have been out there. I think the citizens are solidly behind our decision. The more people I talk to, I believe they are. But should we have a town hall meeting in some of these other communities, Stockdale, LaVernia, would that be worthwhile? Just to invite all the citizens to come and ask all the questions they ever thought they might want to know about EMS services, and not purely informational. In other words, we don't want an argument. We want to provide information. Is that something that would? My concern is there is some negativity out there being promoted by those 20 people we talked about earlier. Maybe a couple of surprises, but do we nip it in the bud by just getting the facts out there in these communities? Would that be a good idea? I think the facts will sell this thing all day long, but I don't know that the public knows all the facts.
Well, I think we need to be as open as possible,
Right.
and we need to make ourselves available to answering those questions. I think we have asked of ourselves a lot of the questions that are necessary to do this. Sure, I think we owe it to the people. I mean, the thing about this board and this hospital is that we've always put the patient first, and we've always put the shareholder first, and that's the people. No question, no question about it. And, we don't have anything to hide,
No.
nothing.
Like I said, the facts will sell the EMS service all day long.
That's right.
But the facts have got to get out to the public. And I don't think there's a problem. I just would like to avoid any problem that might ever be on the horizon. So that's something to consider.
Well, I just to kind of, since we're moving into that agenda, I didn't think of that. To me, the real next step in that was a conversation I had with Nanette at the newspaper, the idea of publishing a definitive guide to the Wilson County EMS situation. So throughout this week, I'll be gathering some of those facts that are also driven by the consultant's preliminary findings of just how the services are structured and staffed and licensed and certified and all of those types of things. And that I think will allow the newspaper to produce that definitive guide that will take many of the misstatements and put them aside. So that's, to me, one step of that puzzle. Then we can use that to refer back to months from now. Hey, this no matter what's going on, well, here are the facts. Here is the definitive guide to this situation.
I think part of the facts too have got to be the conditions and the limitations of what is there now. I think there's been some misinformation in the public realm about the condition and capabilities of the current services. One of the things, I looked at one of the financial statements, and it was Wilson County, I believe, and not a bad financial statement. But what I did not see is any dollars for training, any dollars for additional personnel, no dollars for replacing ambulances. They can make it day to day, but there's no plan for the future. There's also no plan for expansion if the population's increased and services, there's more demand on services. So they're doing an okay job, but if there's anything in the future that puts any kind of pressure or strain on that service, they're not going to be able to handle it, financially or otherwise. And so I think we've been real nice about not trying to step on any toes, but I think part of the reason we're doing this is because there is a cliff looming out there that they're going to go over if something's not done. And so I think those facts have got to get out to some degree also.
I agree. It's just so you see that these things exist. One of the items that I think will be very helpful to us is the actual dispatch map. This has been an item that the consultant helped us to obtain, but it really starts to line out the fact that actually there are not just 4 EMS providers in the county, but there are actually 6. There's a small area of Gonzales County ambulance covers and a small area that Arcadian covers. So we actually have 6 providers in the county. But what I envision, Larry, as part of this definitive guide is to take each of these 4 map sections and overlay it with this, not this literally, but the elements of the matrix here that talks about the different levels of staff. Only one service is MICU 24/7. The different levels of licensure, BLS staff, the level of county support going to each of them, the number of runs in each of the map areas. So to me, I think with a relatively short period of time, based on the consultants' interviews and facts provided by each of the services, we can really start to put together a very good talking document. The other thing that I want to show the board, and I really appreciate Sue's help on this, just so that you know this exists. This project is not started just by, hearsay and all this type of stuff. This is the value of all of the different resources that we've accessed, during the time the board and I have developed this program. We've got, information about, how the different scope of practice laws work. We've got information about, the types of revenues and such that are out there. We've got information about the types of protocols that are there. All of that has been filtered into this process over the period of time, and then hoping to share that information is going to be very, very helpful. Here's just a few more updates for you, and then I'm going to share with you one more hit on this. Consultants preliminary finding, newspaper article, follow up with definitive guide, looking forward to working with Annette on that. Literally today we did, because it was the first of the year, we did post the CMMC county-wide EMS executive director position. That was the next step that I committed to do, and we did that today. So that hiring process will take 60 days, to get some good applicants, do some interviews, 60, 90 days. But our goal is to have that position in place, certainly by the end of the calendar year. That's my goal for that. Of course, that individual will help us go through the licensure process, go through the policy, procedure, protocol process. All of those types of things will be the responsibilities of that individual as we build this service. Certainly over the last couple of
Moving on to another bullet.
I was, but when you started to look like you were talking, I was going to stop.
Okay, so we posted the executive director's position today.
Yes.
How long will that take?
Again, I think the hiring process will take 60 days.
So we should have somebody in place.
By the end of the year.
And you're advertising for that just locally?
No, I think we're going to hit the region. We have, we're going to, this is going to be a very comprehensive both comprehensive but also routine hiring process for us. We're going to make sure that we hit all the local outlets for people who would be interested in this position. But certainly there's a lot of talent in the surrounding areas as well. Seguin, San Antonio, there are plenty of folks around. I actually think that this position will generate a lot of interest in terms of applications. We had 17 applications for the CFO position. So
I didn't find somebody from Mississippi.
who knows? So I think the position number one is going to get a lot of attention. I want to leave the posting up long enough so that we get good applicants. So I mean that's 30 days plus for sure, and then we'll go from there.
So the criteria we're going to use to select this person. We want to be the best hospital in Texas. We want to be the best EMS in the state of Texas.
Yes.
No bull, that's no bull.
Right.
And we realize we won't be that out of the gate. But shortly thereafter, we should be.
Right.
No pressure. But.
When I find the right leader.
But, and that's what I'm getting at is because we're gonna need to have someone of that caliber to deliver those results.
You're right.
So how do you see that? What, can you describe for us, what are you looking for in an executive director to meet that criteria and deliver those results?
I'm looking for a leader, period, number one. I mean, this is certainly going to be a very challenging leadership opportunity. So, you know, we need someone who has that leadership skill. Communication, they have to be able to talk, because, you know, we're gonna not only be talking to staff that we want to recruit and retain, but we're also gonna be, you know, navigating through the attention that this project's gonna get. I mean, certainly, you know, the county entities are gonna have interest in this project, so the person has to be able to communicate very effectively. Probably most importantly though, Ronnie, they're gonna have to be a good clinician. I mean, you know, this isn't, this is gonna be someone who, you know, has, in the field experience, is able to get on the rig, you know, go out and help a situation and lead from a clinical standpoint, so that, you know, any question of quality or any question about how the new countywide service delivers care is not a question. You know, so to me, that's the type of thing that I'm going to be looking for. I think there's one other element, and maybe it's kind of an unknown. It's going to take a lot of energy. I mean, this is going to be a 24/7, 365 operation. You know, providing emergency care across an 866 square mile county, and so that's going to take someone who definitely has some drive and energy to be able to lead that effectively, you know, week after week after week. So to me, that's what I'm looking for.
So you're looking for someone who has got a good bit of experience in the field, has got a lot of qualifications as a EMT, right?
Okay. Or paramedic.
Or paramedic. Is paramedic the highest?
Paramedic is the highest.
So you're looking for someone that's a paramedic that has management capabilities and leadership capabilities.
What about startup experience? Sometimes that's a little bit different experience set than running.
You know, Tom, I mean, that's a really good observation. I don't know that in the number of people that have led, you know, EMS services like this, I don't know how many would actually have had the experience of doing a startup. I mean, you know, many of them are probably, many of the services are already established, but I think, you know, that startup component of it, you're gonna have to rely on me and Carl and Woody and Sue to help with that probably, so. Just because I wouldn't think that, you know, over the last 5 years, there's been all that many new EMS startups.
Well, sometimes you have people that are in that field, they come in and they do the startup and then they move on. You know, so you have the startup person and then you bring in the person that runs it. I don't know that that's, I honestly don't know if that exists in this arena.
Right.
I know it exists in other areas.
Well, you know, I think that undoubtedly, you know, the skills of this person are gonna have to be very, very good, because, you know, there's a lot of folks out there watching the success of our project, and he'll have to be able, he or she will have to be able to navigate that very, very effectively.
It'll be very interesting to see what sort of attention the posting gets.
Yeah. Well, I want to comment on another thing, and just be totally on record on this. I'll be totally on record on it every time. You know, we're going to be using our most formal, routine, full-bore hiring process here at County, like we always do. But I mean, you know, that includes reference checks, that includes drug tests, that includes, you know, multiple layers of interviews, you know, all of those types of things are going to factor in this. So just know that routine hiring process that we use here, you know, I speculate that as this project takes shape, that even that will fall under scrutiny. But we're going to be very, very, very careful to make sure that we're, you know, going through all the right steps to make sure we're hiring the very best person.
Yeah, gonna have to be a high energy person for 2 years anyway, to get it up and going and running. So I think that's the qualities you're looking for are right on. Good leadership ability, they've got to be a good communicator, high energy person, good organizer, good with logistics and so forth, so on, and having a lot of HR skills. And that's probably what you're looking for.
Just a couple of other project updates, and I'm going to go to the next slide here after this, just to have a little more conversation. But over the last 2 weeks, I've obviously had a number of requests for information. Private citizens, again, you're requesting clarification on the tax rate, this various question or that various question, nothing particularly concerning. Just did want to report out that there was a group in Livonia who met that were apparently opposed to the tax discussion. They were beginning some conversations there. My understanding was there may have been a number of staff personnel there, but 14 citizens actually attended that meeting. Moving past that, though, one thing that the hospital did this last Saturday and Sunday for 2 days, we had pre-hospital trauma life support training here. If you remember, one of the things that we offered way back when this whole project started was that we would provide training opportunities for EMS personnel. Saturday and Sunday of this week, we had Andy Sarala and some of her colleagues put on the pre-hospital trauma life support training for EMS personnel, and I believe they had 10 attendees. So again, the idea of trying to get some pre-hospital training out to EMS folks is something that we've done, and apparently those sessions went pretty well the last couple. Other item, just real quick, did take a phone call from a informed citizen who talked about the idea that we're talking about EMS, we're talking about 911 services, but another issue that some of the nursing homes are facing in the area is medical transport. There's been some changes in the private ambulance services throughout the area, and that has delayed availability for medical transport for the nursing homes throughout our community as well. We've seen that same impact here when we have an ER transfer. Not impacting our ER wait times, but our ER disposition times if we have a transfer. Sometimes we're waiting longer than we have been in the past for ambulance services. So I haven't been commenting very much about the medical transport issue, but as this project gets a little bit more traction, that's another element here that I think could be addressed by our hospital.
Is that a different level of service? That, obviously, you may not want to have a paramedic in a fully, technologically set up bus for medical transport, or do you? I don't know.
So you're probably best to
really
answer
do.
that question.
If a patient is sick enough to be transferred to San Antonio, you really want the MICU staff.
Okay.
And that's what the issue is right now.
As I understand it, the local medical transport company has been bought out,
That's correct.
and that company has been moved to San Antonio. And so now, to get medical transport, you have to wait for an ambulance to come out of San Antonio, and I understand that some of the nursing homes, or the nursing homes, are having to wait in some cases over 2 hours to get an ambulance here to do a transport. Well, to follow up on your comment, if it's serious enough to be transported or transferred from a nursing home to a hospital, really, 2 hours? I mean, that once again, that's what we're here for, is the people. And in my opinion, that's not taking care of the people. And people can say whatever they want to about why are you doing that, or why, well, the fact of the matter is that the people shouldn't have to wait 2 hours or more to get an ambulance to be transferred to the hospital. Am I right?
Exactly.
I guess my concept of transport you know, to me, I'm thinking of transport is not urgent.
But
But
there-
that may or may not be, I don't know.
And
So
sometimes-
if it's urgent, then that's EMS
Yeah.
to me. Transport to me would be like, if we have somebody here and they're well enough now to go back to the nursing home and they need transport.
Right.
So, you know, that, I guess that's where my definitions is mixed. If they're in bad condition, or need to go into San Antonio for surgery that we can't do, then that's EMS. That's how I see
So
it.
how will that be handled? Like, if someone from the nursing home comes here, and then, you know, they're released, and they go back to the nursing home, are they released to a family member, or what if they have no one to take them?
If
Would
they
it
come
be
by
us?
the ambulance, then
They
go
can
by.
leave, they go back. But what if they're like staying here? Will they
But they're
still
being-
go back?
But they're being admitted?
Mm-hmm. They're
Yes.
being admitted and then they're released?
Yes, then they go back.
Then they go back by
Yes,
ambulance?
yes. And we're not imagine this, somebody, nursing home patients in the ED, gonna be discharged back, so you have that person waiting. We have upstairs, we have patients upstairs being discharged back from nursing home. We have 5 nursing homes that feed into us. We have patients, residents from nursing homes coming to outpatient surgery. And then just the nursing homes themselves trying to get their patients here. So there's a lot of activity. And Apollo used to be able to provide that. I mean, they had a lot of ambulances here. Now we're down to 1, maybe 2. And so everybody's vying for these 1 or 2. And it's really has made the wait times longer. But that's just for regular transport. Transfer is different. That's to San Antonio, it's a transfer.
And I think we definitely should give a shout out to Stockdale ESD,
Yes.
because they have been extremely responsive to our EMS transfer needs. And they've definitely been helping a lot with that.
Because they're the only 24/7 MICU unit that we have available. So if you have a critical patient, maybe on life support, or that you must, without a shadow of a doubt, you must have MICU. They've been helping us out.
Well, you know, the transport side of the business is more profitable, so it would help, you know, stabilize incomes to our situation. It's also urgent care, but not necessarily emergency care a lot of times. So it's a good training platform, I think, for people that we hire. And also, there's a void in the market, and it will be filled. I think we should fill it. I really do.
Yeah, as long as we can do it reasonably.
Yeah.
Good service, good high level.
It's gotta be good high-level service, but I think there's definitely a void in the market that will be filled sooner or later someday, and I think we probably be able to look at filling it.
We all agree? Okay.